Welcome to this 4K video, your gentle companion through one of the most beautiful yet challenging journeys of motherhood, breastfeeding. Whether you're a first-time mom or supporting someone close, this guide will walk you through everything you need to know, with helpful tips and expert-backed advice to make your experience smoother, healthier, and more comfortable. Breastfeeding is a deeply personal and powerful experience. It's not just about feeding your baby, it's about bonding, comfort, love, and nourishment. The first thing to know is that breast milk is perfectly tailored to your baby's needs. It changes in composition during each feed and as your baby grows, providing exactly what they need at every stage. The benefits are endless. Breast milk contains antibodies that help protect your baby from infections. It's packed with nutrients, enzymes, and hormones that support brain development and immune health. For the mother, breastfeeding helps the uterus return to its pre-pregnancy size, reduces postpartum bleeding, and even lowers the risk of breast and ovarian cancers. The first hour after birth is known as the golden hour. It's the ideal time to initiate breastfeeding. Skin-to-skin contact right after delivery stimulates the baby's instincts to latch and begin feeding. It also helps regulate the baby's body temperature, heart rate, and breathing. Now, let's talk about latching. A good latch is key to comfortable and effective breastfeeding. To begin, bring your baby to the breast, not the other way around. Hold your baby tummy to tummy with you. Make sure their nose is at the level of your nipple. Wait until your baby opens their mouth wide, like a yawn, then gently bring them onto the breast. Their mouth should cover more of the areola than just the nipple. You should see their chin pressed into the breast, and their nose close but not buried. Breastfeeding should not be painful. If it hurts beyond the first few seconds, your baby may not be latched correctly. Gently break the suction with your finger, reposition, and try again. A proper latch will help prevent sore nipples and ensure your baby is getting enough milk. There are several breastfeeding positions you can try to find what's most comfortable. The cradle hold is the most traditional and widely used. The cross cradle hold offers more control and is especially useful for newborns. The football hold is great for mothers recovering from a C-section or feeding twins. The side-lying position is helpful for nighttime feeds and allows you to rest while your baby feeds. It's important to recognize your baby's hunger cues before they begin to cry. Early signs include rooting, sucking on fingers, and lip smacking. Feed on demand, which usually means 8 to 12 times in 24 hours for a newborn. This frequent feeding helps establish and maintain a healthy milk supply. Let's talk about some common challenges. One of the most frequent issues new moms face is sore nipples. This is often due to a poor latch. Applying a bit of expressed breast milk after feeds and letting your nipples air dry can help with healing. Lanolin cream is also soothing and safe for babies. If your breasts feel full, hard, or painful, you may be experiencing engorgement. Try feeding more often, using warm compresses before feeding, and gently massaging the breast during feeds to relieve pressure. Sometimes, mothers worry about low milk supply. The best way to boost it is through frequent breastfeeding or pumping. Stay well hydrated, eat balanced meals, and try skin-to-skin contact. Avoid supplementing with formula unless medically necessary, as it can reduce the frequency of breastfeeding and slow down your milk production. Blocked milk ducts and mastitis can also occur. If you notice a sore lump, redness, or flu-like symptoms, continue feeding from the affected side, rest, and consult your healthcare provider if symptoms persist. Early treatment can prevent complications. Your nutrition is just as important as your baby's. A breastfeeding mother needs extra calories, about 450 to 500 more per day. Eat plenty of fruits, vegetables, whole grains, and proteins. Drink water throughout the day. A good tip is to drink a glass of water each time you breastfeed to stay hydrated. Returning to work doesn't mean you have to stop breastfeeding. Start expressing milk with a pump 2 to 3 weeks before returning. Practice storing your milk in clean containers, label with the date, and refrigerate or freeze. At work, try to pump as often as your baby would feed, usually every 3 hours. Communicate with your employer about your needs. Many places legally require lactation breaks and private spaces. Feeding your baby in public is completely natural and your legal right in many countries. Some moms prefer to use a nursing cover, others don't. Whatever your choice, feel confident. You are nourishing your child and there is nothing more important than that. Support is crucial. Join breastfeeding support groups, talk to a lactation consultant, or speak to other moms. Every journey is unique, but you are not alone. It's okay to ask for help when you need it. At some point, you'll start thinking about weaning. This should be a gradual process. The World Health Organization recommends exclusive breastfeeding for the first 6 months, and continued breastfeeding along with solid foods up to 2 years and beyond. Let your baby take the lead and go at a pace that works for both of you. Breastfeeding isn't always easy. There will be ups and downs, moments of doubt, and days when you wonder if you're doing it right. But every drop of milk, every quiet moment of closeness, and every cuddle you share is building a foundation of love, health, and trust. You are doing an amazing job. Trust your body, trust your instincts, and most of all, trust the bond you're building with your baby. It's one of the most powerful and natural gifts you can give. If you found this video helpful, don't forget to like, share, and subscribe for more gentle parenting tips in stunning 4K. Thank you for watching, and we'll see you in the next video.